Alright, so we're going to be doing some isolated hip strengthening exercises. This first one we're going to be doing is step ups. The patient has advanced to a rather big, large step at this point in her progression. So what I'm going to have her do is bring one foot up, yep, just like that, and step up, yep, she did great. Things we're going to be looking for is making sure she stays in an upright position with her body. She doesn't bring her knees way over her toes. Obviously, we got to make sure she doesn't lose her balance or anything like that. She's doing pretty well at this. We can add in some 5-pound dumbbells at this point, make it a little more interesting. Just like that. This still seems pretty easy. We could advance this to something like a barbell over the shoulders, help her pause. Yeah, just like that. Add more weight onto it, and we could also get an even bigger step since she is doing pretty well with this one.
Okay, and the next exercise that we can do is a wall squat. And since we don't usually use a TheraBall to help the patient roll up and down against the wall, but since we don't have the ball, we'll just have her against the wall. And we'll have her feet about shoulder width apart and out in front of her. And what we want her to do is to go from about 0 degrees of knee flexion to 60 degrees, rolling down the imaginary TheraBall or physio ball. And we're going to tell her to go to about that point where she may be experiencing some of that patellofemoral pain, and then coming back up. And this will kind of activate more of the quadriceps and maybe the hamstrings to help facilitate some of those stabilization muscles. And to progress this exercise, we can have her actually go down to that 60-degree point and hold it isometrically. So you can have her hold that position for 5 seconds and then come back up out of that position. And then if we want to further challenge her, we can actually add dumbbells while she's doing the squat. And we can also move her into a one-leg 60-degree squat as well to progress that too.
All right, so next we are going to do the plank series. This has been shown to help with patellofemoral pain syndrome, just tightening the whole core, including the hips. So I will have my patient lie prone and then press up onto his elbows. Yep, so this is pretty good form. What we're looking for is for him to pull his belly up to the ceiling and keep his back flat like that. Shoulders are flat. So this would be good. To progress this, we could have him go up onto straight arms. Yep, and then we could do different dynamic movements like this knee to this arm. Yep, and then stuff like that, other progressions. Starting out, you'd probably want to hold the plank for about 30 seconds and then progress to longer duration, adding about 5 seconds each time. And then we will go into the side plank, so I'll have you side bridge. Yep, so same stuff. Ankles are stacked on top here. We're going to make sure that there's a 90 degrees right here, and then I'm also going to pull his hips just a little bit forward so that they're stacked on top of each other. This looks pretty easy for him, so then we could eventually progress him up to a straight arm side plank and go from there.
All right, and then we'll have him lay on his side. Yep, just like that. Just lay down. So then I'll show you some isolated glute med exercises to really just isolate that glute med muscle. So our patient will be sidelined just like he is, and then I'm going to have him go ahead and abduct the leg with slight external rotation and a little bit of extension. So these positions really make sure that glute med is the muscle working. So then bring it all the way up with your toes up a little more. Good. And then back down. And then that's the exercise. And you can progress this by adding a TheraBand, using ankle weights, many different progressions for this exercise to really isolate the glute med. And So all the exercises you saw during this lengthy video are good hip isolation muscles to isolate the different stabilizer muscles of the hip. And then that can be very beneficial for patients with patellofemoral pain syndrome.